How does ayahuasca affect the brain? Have you ever wondered how a traditional brew from the Amazon can impact the way our brains work? Let's take a closer look at ayahuasca and its effects on the brain, especially in the context of addiction and hallucinogen use. Ayahuasca is a psychoactive drink that contains dimethyltryptamine and harmala alkaloids. These substances interact with serotonin receptors in the brain, particularly the 5-HT2A subtype. This interaction can lead to changes in perception, mood, and thought patterns, which are common effects of hallucinogens. Interestingly, the effects of ayahuasca are not just fleeting. Research indicates that it may influence the brain's structure and function over time. One of the key effects is on brain plasticity, which is the brain's ability to adapt and reorganize itself. Ayahuasca seems to boost synaptic plasticity and may even promote the growth of new neurons, a process called neurogenesis. This could explain why some users report lasting changes in their mood or outlook after using it. Moreover, ayahuasca affects dopamine transmission. Dopamine is essential for how the brain processes rewards and motivation. Changes in this system might contribute to both the therapeutic effects some users experience and the potential for misuse or psychological dependence. Another fascinating aspect is how ayahuasca impacts the brain's default mode network. This network is involved in self-referential thinking and mind wandering. When ayahuasca is used, there is often decreased connectivity in this network. This reduction can lead to more flexible thinking and may help users gain new perspectives on personal issues or traumatic memories. From a neurobiological standpoint, repeated use of ayahuasca has been linked to structural changes in specific brain networks. Users may show reduced thickness in areas related to higher-order thinking, while experiencing increased thickness in regions involved in emotion and memory. These changes can have both positive and negative effects, depending on the individual and their context of use. When it comes to addiction, ayahuasca is not typically seen as highly addictive. It does not usually lead to the compulsive drug-seeking behavior associated with substances like opioids or stimulants. However, like other hallucinogens, it can lead to psychological dependence in some users, especially those looking for relief from mental health issues. The intense experiences that ayahuasca can induce may pose risks for individuals with a history of psychiatric disorders or substance use problems. Using ayahuasca outside of traditional or supervised settings raises safety concerns, including the risk of adverse psychological reactions and interactions with other substances. While some studies suggest potential benefits for conditions like depression and post-traumatic stress disorder, these findings are still preliminary. They do not outweigh the need for caution, especially considering the legal status of ayahuasca in many countries. In summary, ayahuasca affects the brain by altering serotonin and dopamine systems, increasing plasticity, and changing communication between different brain regions. These effects can lead to significant shifts in perception and mood, offering possible therapeutic applications but also risks, particularly for vulnerable individuals. Understanding how ayahuasca interacts with the brain is essential for recognizing its potential risks and benefits in the context of addiction and hallucinogen use.